Hey there viewers, welcome to our channel. Have you ever felt like someone you know has been replaced by an identical look-alike? It might sound like something out of a sci-fi movie, but for some people, this is a real experience. Today we're diving into a fascinating and complex topic, Capgras Syndrome. This rare condition affects how people perceive their loved ones, and it's more than just a passing feeling. We'll explore what causes it, how to spot it early, and what can be done to help those affected. So let's get started on understanding this puzzling disorder. Capgras Syndrome, also called Capgras delusion, is a rare psychiatric condition. People with this syndrome believe that someone close to them, like a family member, has been replaced by an exact double. It's not just a fleeting thought, but a firm belief that can last for a long time. This condition falls under a group called delusional misidentification syndromes. It can be really tough for both the person experiencing it and their loved ones. So, what causes Capgras syndrome? Well, the exact cause isn't fully known, but there are several factors that might play a role. First, there's the brain itself. Injuries to certain parts of the brain, especially the right side, can lead to this condition. These areas are important for recognizing faces and connecting them with emotions. Conditions like dementia, Alzheimer's disease, and epilepsy are often linked to Capgras syndrome. It's not just about physical brain issues though. Psychiatric disorders can also be involved. People with schizophrenia or bipolar disorder are more likely to experience Capgras syndrome. It seems that there's a disconnect between the part of the brain that recognizes faces and the part that feels emotions about those faces. Brain chemicals might also play a part. Neurotransmitters, especially dopamine, could be out of balance. This imbalance might contribute to the unusual beliefs seen in Capgras syndrome. Life events and stress can also trigger this condition. Major life changes, traumatic experiences, or shifts in relationships might set it off in someone who's already vulnerable. Now let's talk about how to spot Capgras syndrome early. Catching it early is really important for getting help quickly. One big sign is sudden changes in how someone acts towards a familiar person. They might become hostile, fearful, or suspicious of someone they used to trust. Listen closely to what the person is saying. They often clearly state their belief that a loved one has been replaced. They might say things like, "That looks like my wife, but I know it's not really her." Doctors can use cognitive tests to help diagnose Capgras syndrome. These tests look at memory, perception, and thinking skills. They can reveal if there are any underlying brain or mental health issues. It's also important to look at the person's medical history. Past head injuries, neurological conditions, or mental health diagnoses can provide important clues. While we can't completely prevent Capgras syndrome, there are ways to lower the risk and manage it better. Early treatment of related conditions is key. If someone has a head injury, dementia, or schizophrenia, getting prompt care might help prevent Capgras syndrome from developing. Medication can be helpful in managing symptoms. Antipsychotic drugs and mood stabilizers might help balance brain chemicals and reduce delusions. Therapy, especially cognitive behavioral therapy or CBT, can be really beneficial. It helps people challenge their unusual beliefs and find ways to cope with anxiety and stress. Creating a supportive environment is crucial. A stable, understanding atmosphere can reduce triggers that worsen the delusion. Involving family members in therapy can improve support for the person with Capgras syndrome. Education is also important. The more people know about this condition, the better they can recognize and respond to it. This includes both healthcare workers and the general public. Let's hear from some experts on this topic. Dr. Sarah Thompson, a psychiatrist who specializes in delusional disorders, says,
"Early diagnosis and a combination of pharmacological and therapeutic interventions are key to managing Capgras delusion. Involving family members in the treatment process is essential for providing comprehensive care."
Dr. Michael Lee, a neurologist, adds,
"Patients with a history of head injury or neurodegenerative diseases should be closely monitored for signs of Capgras syndrome. Timely intervention can prevent the delusion from becoming deeply entrenched."
Capgras syndrome is a complex condition that affects how people see their loved ones. We've learned about its causes, how to spot it early, and ways to manage it. Remember, early detection and a combination of treatments can make a big difference. If you or someone you know might be experiencing symptoms like this, it's important to talk to a healthcare professional. Thanks for watching this video on Capgras syndrome. If you found it helpful, please like and share it with others who might benefit from this information. Don't forget to subscribe to our channel for more videos on interesting medical topics. Have you ever encountered a situation like this? Share your thoughts in the comments below. Take care, and we'll see you in the next video.